So hello friends, now this is the next part of our blood pharmacology. In this we are going to discuss about hypolipidemic drugs. Okay, drugs which are used for lowering the lipid in your blood. So first coming to the lipid. So lipid is of two types basically which we are interested in here in this particular topic: triglyceride and cholesterol. Okay, cholesterol promotes your atherosclerosis that will lead to MI and stroke, and this triglyceride is responsible for acute pancreatitis and it also increases the risk of diabetes mellitus. Clear? So we will first start the hypolipidemic drugs, then we will, this is the general physiology, okay, which we are not interested here. We are just going to start the drug particularly and the mechanism of drugs. So hypolipidemic drugs are categorized into 5 categories. Okay, the first one group is your the most important, that is statins. Okay, the second one is your resins, the third one is your fibrates, then the fourth niacin, and there are some newer drugs. Clear? So first starting with the statins, that is the basic drug for this and the most important drug. The most important category of drug is this statins. Clear? Now coming to the mechanism of action of a statin. So this statin basically inhibit de novo synthesis of cholesterol in liver. Okay, de novo synthesis of cholesterol in liver will be inhibited by this statin, because statin is inhibiting the enzyme which is known as HMG-CoA reductase. Okay, because this HMG-CoA is converted into mevalonate, which is finally leading to the synthesis of cholesterol, and this conversion HMG-CoA to mevalonate is done by HMG-CoA reductase inhibitor. So statins just inhibit this enzyme HMG-CoA reductase, and so that will decrease the cholesterol synthesis. And but see, cholesterol has to synthesize bile, and bile needs cholesterol. So what liver will do? Liver is not able to synthesize cholesterol. So what liver will do? Liver will, suppose this is liver, so liver will increase its receptor of LDL. LDL receptor will be increased on liver surface, and from blood LDL will be absorbed into liver, and that is used for synthesis of bile. Clear? So here see, decrease cholesterol in liver will increase LDL receptor on liver, and that will decrease LDL in blood, because LDL is coming from blood towards the liver for synthesis of bile, and that will also decrease SDL in blood. Clear? Okay, so this is the mechanism of statin. This is the how statin works. Now what are the drugs are only given orally. Okay, these all drugs are given orally. The drug are lovastatin, then pravastatin, fluvastatin, simvastatin, atorvastatin, then rosuvastatin and pitavastatin. Clear? Just remember LP, FARP, SARP. Okay, so these are the drugs. Now most potent is your pitavastatin. The most potent drug is pitavastatin. Only 2 mg is administered. Pitavastatin, and least potent are this lovastatin and pravastatin. This dose is 40 mg and the potency increases downwards. Clear? Now, so there are some MCQ question. Most potent pitavastatin, longest acting is your rosuvastatin, then safe in anuria is your atorvastatin, maximum oral viability is seen with fluvastatin. So there are some MCQ question, not so much important, don't worry for that. Okay, the two are prodrugs such as lovastatin and simvastatin. These two are prodrugs. And remember, this is important, all statins are metabolized by your CYP3A4 enzyme except fluvastatin, which is metabolized by CYP2C8, and rosuva and prava, they are not metabolized by CYP enzyme. So this metabolism is somewhat important. Clear? Okay, and now coming to the efficacy of these drugs. So statins causes maximum decrease in SDL level. Okay, maximum SDL level is decreased by this group of drugs, that is statins. Okay, more than 50% reduction will be seen if you are giving rosuvastatin. Clear? Indication is same, MI or stroke, you can use this drug. If LDL level is more than 190 mg per dl, you can use this drug. Or patient with diabetes mellitus having increased SDL, in that particular you can also use this drug. And rosuvastatin dose is 40 mg, which we start usually, and atorvastatin 80 mg. Okay, rosuva 40 or atorva 80. Now coming to the contraindication of this drug. So these drugs are contraindicated in pregnancy and children less than 12 years. So what type of hypolipidemic drugs should be used in this two conditions, pregnancy and children less than 2 years? So the drug of choice will be your resins. So resins are generally used in pregnancy and in children who are less than 12 years. Clear? So remember these two contraindications. Now coming to the side effects which are associated with this statin group of drug. So the first is your hepatotoxic. These drugs are hepatotoxic. Second, myopathy. Okay, and this is the most characteristic side effect of statins. Remember this is the most characteristic side effect, this myopathy. This myopathy will be the most characteristic side effect of the statin group of drug, and this myopathy will lead to rhabdomyolysis, that will lead to degeneration of skeletal muscle basically. Okay, and this is a very dangerous condition, and the muscle damaging starts, and there will be some electrolyte abnormality, such as there will be hyperkalemia, lactic acidosis, myoglobinuria, because muscles are damaging and the content of muscles are coming outside, so that will lead to hyperkalemia, lactic acidosis, myoglobinuria, and that will lead to acute renal failure. Clear? There will be increased risk of myopathy on combination of statin with other hypolipidemic drug and CYP inhibitor. So there will be increased risk of myopathy. So just remember, your myopathy is very, very important. Clear? Now let's discuss about some other effect of statin, the pleiotropic effects of statin. So many other benefits are of statins are also there, along with decreasing lipids. So statins are anti-inflammatory in nature. Statins also decreases your uric acid. Statins are antiplatelet as well. Statins also decreases your plasma fibrin level. Statins are also acting as antioxidant. Statins also increases your NO production. So these are the other effects which are associated with your statins. Okay, these are the other effects which are associated with statin. Now coming to the usage. So it is drug of choice. Statins. We are coming to the uses of statin. So statin is drug of choice for familial hyperlipidemia type 2 and type 5, because in these two type of familial hyperlipidemia there will be increased amount of LDL, and we are knowing this statins causes maximum decrease in LDL. So drug of choice for type 2 and type 5 familial hyperlipidemia. Is again drug of choice for acquired hypercholesterolemia, which is seen in any metabolic syndrome or nephrotic syndrome or alcohol induced. Then it is also drug of choice for fatty liver. So these are the three area where this statins are drug of choice: familial hyperlipidemia type 2 and 5, acquired hypercholesterolemia, and fatty liver. Now coming to the next group of drug, that is resins. So bile acid binders, basically they just inhibit your intrahepatic circulation of bile. Okay, they inhibit reabsorption of bile. Okay, intrahepatic reabsorption of bile is inhibited by this drug. So if bile is not reabsorbed, then there is need to resynthesize the bile, and for resynthesis of bile, liver will require LDL, so it will again take cholesterol from blood. So this is the basic mechanism how these resins work. Okay, this will increase LDL receptor on liver, and this will decrease blood LDL. Drugs coming under this: cholestyramine, cholestyramine, and cholestyramine. Cholestyramine is also approved in type 2 diabetes mellitus treatment. Clear? This cholestyramine decreases absorption. Its absorption gets decreases. Okay, due to dioxin and thyroxine. Now coming to the uses of these resins. So they are drug of choice in pregnancy and children. They can be added to statin. Okay. Side effects are they are unpalatable. They may lead to steatorrhea and bloating effect. So these are resins. Now coming to the fibrates, another important group. These fibrates are basically PPAR alpha agonist. Okay, this fibrate stimulates your PPAR alpha, which is present in nucleus of endothelial cells. So this, when you give fibrate, these fibrates will just stimulate the receptor, that is PPAR alpha receptor, which are present in nucleus of endothelial cells, and by stimulating those receptor, it just increase the synthesis of lipoprotein lipase, and if lipoprotein lipase synthesis increases, it will decrease amount of triglyceride. So triglyceride amount will be decreased. So just remember, fibrates are used for decreasing triglyceride amount. Clear? And it is activating which enzyme? Lipoprotein lipase. So it causes maximum amount of decrement in triglycerides. So it is drug of choice for hypertriglyceridemia, means familial type 3 and 4, because in these two there will be increase in triglyceride. It also decreases the risk of acute appendicitis, because we have discussed in our initial part that triglyceride is responsible for acute appendicitis. Now there are drugs coming under this. So the first drug is cloffibrate, but this is banned nowadays. Okay, this drug is banned. We use fenofibrate, bezafibrate, and gemfibrozil. These drugs are important. Fenofibrate, bezafibrate, and gemfibrozil. Fenofibrate also decreases uric acid, and this bezafibrate has no risk of myopathy. And these fibrates are given generally along with food to increase its absorption. So this is also important. These fibrates are given along with food to increase the absorption. Now what are the side effects of these fibrates? So gallstone is the most important side effect, and myopathy, but bezafibrate do not show that myopathy side effect. Clear? Now coming to the next group, next drug, that is niacin. Niacin is also known as nicotinic acid or vitamin B3 or all or 9. In low dose, means in microgram, it has only vitamin activity, but in high doses, means in grams, it has hypolipidemic activity as well. Now what are the effects? So on liver, it decreases triglyceride synthesis, increases HDL and decreases lipoprotein A, and on adipose tissue it increases lipolysis. So this is the effect of niacin, and uses add-on drug to fibrate or statin in some resistant cases. And remember the most important point, that niacin is the most toxic among all the hypolipidic drugs. It is the most toxic among all the hypolipidic drugs which we are discussing here. The most toxic among all the hypolipidemic drugs. Okay, this will be the most toxic among all the hypolipidemic drugs. Now coming to side effects. So most common side effect is flushing, that is also known as niacin induced flushing, and for that we have discussed drug of choice will be aspirin. For that treatment, niacin induced flushing treatment, the drug of choice will be aspirin. Then it will be hepatotoxic also, hyperglycemia, hyperuricemia and hyperpigmentation. So these are the common side effects which are associated with your niacin. Very important side effects are there. Now coming to the next new drugs, that is first drug is ezetimibe. So it inhibits just sterol absorption from GIT by inhibiting one transporter, that is known as NPC1L1 transporter. So this ezetimibe just inhibits this NPC1L1 transporter. By inhibiting this NPC1L1 transporter, it decreases absorption of lipids. Clear? Then you have drug like PCSK9 inhibitor. This enzyme that degrades LDL receptors on liver basically. This enzyme which degrades LDL receptor on liver. Hence these drugs directly, okay, this enzyme, this PCSK9 is an enzyme which degrades LDL receptor on liver. So we have developed PCSK9 inhibitor. So these drugs will inhibit PCSK9. So there will be increased amount of LDL receptor on liver. So it includes two drugs, evolocumab and alirocumab. Clear? And this drug inclisiran is in trial. Then we have next drug, that is mipomersen. Okay, this is antisense oligonucleotide that decreases your ApoB100 production. Clear? Okay, so remember this drug, only name of the disease, not going in detail. Then the next is omega-3 fatty acid, also decreases VLDL production. Okay, and this is found in fish. Clear? So these are the newer drugs. Just remember the names of the drug, that is important. And you can also go for the lipid profile of different drugs we have discussed: statin, resins, fibrates and niacin. So this is about your hypolipidemic drugs. Okay, the next drug is your lomitapide. It decreases your VLDL production. The next drug is CETP inhibitors, means cholesterol ester transferase protein inhibitors. Okay, this will increase your HDL production, including enacetrapib and torcetrapib. So just remember the name of the drugs. Name of the drugs can be asked in viva exams. So this is all about your blood pharmacology. From next part we will start with either CNS we are going to start, or we are going to start your endocrine. So thank you for watching. Please subscribe and support us. So thank you once again.